The COVID-19 booster drive in the US is losing steam, worrying health experts who have pleaded with Americans to get an extra shot to shore up their protection against the highly contagious Omicron variant. Just 40% of fully vaccinated Americans have received a booster dose, according to the Centers for Disease Control and Prevention. And the average number of booster shots dispensed per day in the US has plummeted from a peak of 1 million in early December to about 490,000 as of last week. A new poll from the Associated Press found that Americans are more likely to see the initial vaccinations rather than a booster as essential. Overall, the US vaccination campaign has been sluggish. More than 13 months after it began, just 63% of Americans, that's 210 million people, are fully vaccinated with the initial rounds of shots.
Reception has been very tepid to getting boosted, and there are many reasons for that. A slow start to the communication about it, a lot of questions from the scientific community. But again, like all of COVID, science changes rapidly, and in the age of Omicron, it's kind of a really important foundation of protecting the population from getting into the hospital. So to me, as a healthcare professional, it's a no-brainer, but I can also understand why people are not feeling the same way. The vulnerability is most pronounced in those over 65 and those who have comorbid conditions. But nevertheless, when you look at the population aggregate, the data is unmistakable. If you've gotten boosted, you're close to 90% in prevention of hospitalization. If you've just gotten 2 shots, it hovers around 65 to 70% in Omicron. That's a huge difference. And even for infection, which we think, vaccines don't work, if you've gotten boosted, particularly recently, you're about 70% protected versus 0 to 20% against just getting infection as a 2-dose series person. So that's why the CDC changed its quarantine guidance to saying, if you're 2 doses of vaccines, you're just like an unvaccinated person in having a risk of breakthrough infection. And that's because Omicron changed our calculus. The booster uptake also seems to be aligned with politics. And there's a huge difference between certain states by as much as 50%, which has not been seen before in any other vaccine difference. So I think that might need to be addressed as well if you want to have everyone come on board.
Arise US Correspondent Rotimi Kade joins us now. Rotimi, thanks for joining us on Newsday. Let's look at this tragedy that is unfolding off the coast of Florida. What's the latest?
Well, good morning. Dozens of people are still missing off the Florida coast, and the U.S. Coast Guards are searching day and night since Saturday to actually see if there's any sign of life in the sea. Officials are searching from Bimini, is an island coast just off the Bahamas to Fort Pierce, an area roughly about 135 miles wide. However, incidents with vessels crowded with people without vests are very uncommon in the waters. Not very uncommon in the waters of Florida, but many of the cases involve migrants from Cuba and Haiti, and many of the poorer nations around the world are trying to reach the U.S. Most of these voyages or journeys are done in treacherous weather conditions when it is assumed that there is less security within the borders of the U.S. So far, according to the lone survivor, who has not been identified, none of the passengers was wearing a life vest at the time when the journey started. As of this morning, there are no further survivors that have been found.
And this news that broke out as the U.S. interagency task force, addressing trafficking. What has the Vice President Kamala Harris been saying about human trafficking?
Well, the Vice President was doubling down on the economic and social damages human trafficking has done to the world at large, and how cooperation among agencies and interagencies and governments around the world can limit or eradicate trafficking in persons. And she said human trafficking globally is about $150 million business, and majority of the trafficked persons are subjected to forced labor in those countries where they're trafficked. And she also said that the administration, as at last year alone, seized shipments of merchandise worth over $500 million. And they're committed to do more in the coming years.
And Rotimi, turning to the COVID-19 pandemic there in the States, news that the drive for booster jabs is losing steam is very concerning. What's happening there?
Yes, of course. A majority of people who have been vaccinated, which means you've had the first installments of your vaccinations, are very reluctant to actually get the booster shots. The reason being that some people said they reacted abnormally to the initial vaccines, and they are very skeptical about getting the boosters because they don't actually know how much of health hazard that could cause to their body. So they are really concerned about that. And some other people feel that it is way too much for their body to actually be taking some of those vaccines. The inconsistency in terms of messaging from the FDA or perhaps the health experts who have been responsible for dishing out the importance of getting, the booster shots. So there's a similarly vaccine fatigue that's been setting in, but nonetheless, I think there've been a measurable increase in some parts of the country. Like in Vermont, where this state is assumed to have at least about 60% of booster shots being administered to people who have been earlier vaccinated. But the number generally has been below 50%, and I think the administration would have their work cut out for them in terms of trying to advertise and sell the importance of booster shots around the country.
Rotimi Kade, thank you so much for joining the program and giving us an update on all of that.